You know that feeling where your health story is just scattered everywhere? Like a lab result is in one place, a doctor's note is somewhere else, and who knows where that prescription went on your phone. Well, today, we're going to talk about a new platform called Quadra, and its whole goal is to gather up all those scattered pieces and help you, well, rebuild your health story using some pretty powerful AI.
So, what's on the agenda? First, we're going to jump into the big problem Kudra is trying to solve, this whole fragmented health story. Then, we'll get into the solution, starting with a unified health record and moving all the way to this wild concept of a digital twin. After that, we'll see why it's more than just an app, and we'll finish up by looking at how it could create a whole new health economy. Let's do it.
Okay, first things first, let's talk about the problem. The folks behind Quadra believe the biggest issue in healthcare right now isn't that we don't have enough doctors. Nope, it's that we have a serious lack of connected information. And this quote right here, it just hits the nail on the head. Think about it for a second. Your medical history is like a puzzle with pieces scattered all over the place. Different hospitals, various labs, random clinics. So when you end up in an emergency room, the doctor is basically starting from square one, trying to figure you out. And that information gap, it's not just annoying, it can actually lead to really bad outcomes, delayed decisions, even dangerous medical errors. This slide really lays out the big shift QUD is pushing for. You see, today, healthcare is mostly reactive. It's kind of like we wait for our car to break down on the side of the road before we even think about fixing it. The vision here is to flip that completely, to become proactive, to use your complete health story to predict and prevent that breakdown from ever happening. So, how do you even begin to do that? Well, the very first step has to be fixing that data problem. And Quadra's core solution is simple but powerful. Bring your entire lifetime of medical history into one single, super secure place.
Now I want to be clear, this is not just some digital filing cabinet. The Unified Medical Record, or UMR, is more like a living, breathing map of your health that actually follows you around, not the hospital. The whole point is to cure what they call medical amnesia. You know exactly what I'm talking about, right? That feeling when you have to tell your whole life story to a new doctor because your records are stuck somewhere else? Yeah, the UMR wants to make that a thing of the past.
All right, so now you've got all the data in one place. This is where it gets really cool. Quadra then unleashes its AI engine to actually read your entire health story. But it's not just looking backwards to see what happened. It's looking forward to start predicting what will happen. Now, it's super important to understand that this AI is meant to be a sidekick, a support tool for you and your doctor. It is absolutely not trying to replace clinicians. Think of it more like a super smart watchdog that's constantly analyzing your health trends. It can spot things like a slow, sneaky increase in your blood sugar over a few months, or flag a potential drug interaction. Basically, it's catching problems early, way before you'd probably even notice any symptoms yourself.
So what does this actually look like for you, the user? Well, it's a pretty straightforward process. First, you get onboarded and connect all your records. After that, the system really takes over and does all the heavy lifting. It maps out your history, analyzes it with that AI engine we mentioned. That's what generates all that personalized guidance. And here's the kicker. It all boils down to a simple emergency code. One click, and a paramedic can get instant access to your vital info when every single second counts.
Okay, this next part is where things start to feel a little bit like science fiction. We're talking about the most advanced piece of the whole platform, the genomic digital twin. This is where the system levels up. It goes way beyond just your medical history and starts pulling in your unique genetic code to make predictions that are, well, truly personal.
So this is not just a file. It's a dynamic digital model of you. By weaving together your genetics and your medical history, it can literally simulate how your body might react to something, like a new medication. Just imagine this. A doctor could test a chemotherapy treatment on your digital twin first, tweaking it to find the perfect dose with the fewest side effects, all before you ever take a single pill. I mean, that is the very definition of precision medicine.
You know, when you see all this technology working together, it becomes pretty clear that the goal here is way bigger than just creating another health app for your phone. This is designed to be a whole new foundational system, a new kind of infrastructure for health.
And this quote, it really gets to the heart of their mission. Apparently, this whole vision came from a really personal place. The founders actually went through a family health crisis and saw firsthand just how damaging a fragmented system can be. They didn't just see a problem, they saw a fundamental structural gap in healthcare. And Quadra is their big idea to finally fill it.
And that adaptability is what makes it so unique. It's not a one-size-fits-all kind of thing.
For example, in a country that doesn't have a lot of digital records yet, Qdra could step in and become the main health system. But in a place with big, established hospitals, it can act more like a smart intelligence layer on top, connecting all the separate systems so they can finally talk to each other. It's basically designed to fit in and fill whatever gap is there.
All right, now for the final piece of the puzzle, and honestly, this might be the most innovative part of the whole thing. We're talking about creating a totally new economic model, one that actually rewards you for staying healthy.
So the idea is called micro-preventive assurance, or MPA for short. And the easiest way to think about it is like a rewards program for your health. Let's say you're managing high blood pressure. Every single day you log that you took your medication on time, boom, you earn points. And over time, those points could add up to real, tangible rewards, like a discount on your next doctor's visit or even on your health insurance. It's a system that's literally designed to turn prevention from being a chore into a valuable asset.
And wow, it is so clear that people are ready for this kind of change. I mean, the global market for digital health is massive. We're talking hundreds of billions of dollars. But let's forget the big numbers for a second. Behind all that money are millions and millions of real people just looking for a smarter, more connected, and yeah, more proactive way to take control of their own health story.
So after all of this, the AI, the digital twins, the whole shebang, it really all comes back to one very personal and I think pretty powerful question for you. If your entire health story could be laid out, perfectly understood, and if your future health risks could be predicted, would you actually change how you live your life? It's definitely something to think about.